We've looked at how to assess the feet and ankles with an active assessment, and now we're going to complement that with a passive assessment, specifically looking at the mechanics of the foot. Okay, so the first thing we like to do is look at how the foot moves in general. How well does that big toe extend? Is there a difference between the two sides? How well does it flex? How well do all the toes move? Just get a kind of a general feeling of what's happening in the foot. And then we want to just look at the subtalar joint, which is obviously the joint between the calcaneus and the talus, and just see, does it pronate, does it evert? And then what we try and do is find somewhere where the person would be standing and their heel would be flat. So I'm looking actually down at their skin at the base of their heel there. Then I want to see, is their forefoot also flat? If it's this way, we have a forefoot varus or a forefoot valgus. So some people, I put their subtalar in, a kind of a relatively neutral position, if we can use that word, and their forefoot will be up like this. And that tells me that when they're standing, they're going to have to pronate or collapse through the mid-tarsal joint here in order to get their foot stable with the tripod. Tripod being the base of the first ray here, the heel, and then the fifth met, that tripod that contacts the ground. So when a person walks forward, their heel hits the ground and it pronates down inwards or everts inwards. Subsequently, this toe is then relatively pushed up by the ground. So does the foot have the capacity to do that? In this case, it does. When this foot is behind, she is extending through her big toe and pushing off through her the ball of the foot here, and the heel goes into supination with the windlass mechanism. Does she have the ability to do that? Yes, she does. So her foot moves quite well initially. Then what we're going to do is check the medial border, and so I'm looking at where the first met meets with the medial cuneiform, and I'm just testing it, does it move? Then the medial cuneiform with that navicular, does that move? Then the navicular, we can find on the inside here, how does that move with the talus? And so everything seems to move quite well on the medial border. Lateral border, we're looking at the fourth and fifth met and looking at how they work with the cuboid and then the cuboid itself. If we come onto this foot, you can see that better. We just go down, find that stylo process there, and just move the fourth and fifth met up and down up on the cuboid, then move the fingers down onto the cuboid, see how that works, and just get a kind of a general impression through these medial cuneiforms. Again, with a circular motion and just gentle articulation, we can assess how those cuneiforms work. I would do this for assessment both sides. Moving up onto the ankle, I want to see how well does the tibia translate posteriorly on the talus and how well does it translate anteriorly on the talus. I'm really just looking in there, just seeing, is there some good movement? Interestingly, the inferior joint here, the inferior tib fib, has a very small amount of movement in it as well. As you can see that here, I'm holding onto the fibular head, I'm just moving it back and forth. And so sometimes when that moves a lot, when we look up at the other end of the fibula here, it moves a little. It's stuck here, moves a lot here, or vice versa. Stuck here, moves a lot here. So that's just something to check. Now we've looked at how the mechanics of the footwork, we can combine what we've learned in the active assessment with our passive assessment and come up with a great treatment approach for the client.